Welcome to Conversations with Sarah. I'm Sarah Redden, therapeutic coach of SRTT, and today I'm joined by Gemma Dearsley, founder of the Lighthouse Centre. Welcome, Gemma. Thank you for joining me.
Thank you. Good morning, everybody.
Thank you so much for coming along and talking to me about your charity. I guess a really good place to start would be, what is the Lighthouse Centre?
We're a charity local to Northamptonshire. I set it up some years ago. I used to teach Reiki at Cynthia Spencer, but as with everything, the funding got pulled and I could see how much it benefited the patients. So we offer complementary therapy to patients with long-term conditions or cancers in their own homes. It's been really prevalent during COVID, obviously, because treatments have been stopped, been postponed. So people having that support has been vital. I've got a wealth of healthcare experience between us. We offer counselling, reflexology, Reiki, clinical hypnotherapy, and various other therapies to support people's journeys.
Fantastic. I've done podcasts on most of the therapies that you already do, so people can kind of listen back to other podcasts and get a little bit of an insight into what those different treatments are. What inspired you to set up the Lighthouse Centre?
Having been part of the training team at Cynthia Spencer for complementary therapy, then when it stopped, I was nursing. I had a patient I was nursing, and she said to me, if I could set a charity up helping people the way you've helped me, I would. So a few months later, over a bottle of wine and a takeaway, where all the best ideas come.
Of course.
Yeah. I said, I'm going to do this. And everyone was like, yeah, you will as well. And that's where it started.
Yeah.
It started with plays on names because I wasn't sure what to call it. It was all the different names that are out there. And then abbreviated, the Lighthouse Centre becomes TLC, which is what we offer as well.
Yeah, I mean, and I know you personally, so I've seen the journey that you've gone along, and been involved in the peripherals of some of the things that you've done, and actually is how I met my husband. So it was really exciting when you said you would come and speak to me today, because I see firsthand, I've seen your journey, and I see, like, through the social media, like, how you help people, and it's so important. What you do is so important, and I think being able to kind of shine a little light on you and be like, this is here, this place is here available for you if you're going through this experience, is so important. So people, how do they get in touch with you? How do they find you?
Loads of different ways. We've had referrals from district nurses, practice nurses, palliative care nurses. We've got some flyers at the General down in the Macmillan Suite. There's Facebook, Twitter, LinkedIn, Instagram, telephone, email, text message, whatever is the person's chosen form of communication is the way we can react. Some people don't like phoning, but they'll send you a text message or an email. Some people don't like technology or haven't got access to technology, so they'll phone. We've got every form of communication available to suit everybody's needs.
So you don't have to come in through a doctor or like a hospital specialist. You can get in touch yourself and say, I feel like I need your support.
Yeah, a lot of ours are self-referrals. We've had GPs recommend us, but if the person gets in touch with us, then it means they're in control of one part of their life, which a lot of the time when you're going through these situations, you're not in control.
Yeah. So who specifically do you help? Because I know you said like long-term conditions and going through cancer. So if someone's listening in the Northampton area and thinking, well, does this apply to me? I guess what's the criteria?
It's a cancer, so it can be any cancers out there, and blood-borne cancers, so leukemias, etc. It's a long-term condition is a condition that you are never going to be healed from. So one of our patients has got secondary progressive MS. We had one, God love him, who died. He was a haemophiliac who got infected with the HIV, with the blood in the 80s. So we used to do Reiki with him. There's a lot of mental health at the minute. And although we are counsellors, we can also refer on to appropriate for mental health professionals if it's needed. But if it is just somebody they need to talk to and go through things and just feel that there's somebody there, then we're here as well.
Yeah, so I guess like a listening ear service type of thing.
Yeah.
And that's so valuable. It's important to sort of be able to have these like spaces that you can go to and offload your anxiety and feel a bit more sort of positive and get a bit more positive outlook around the world, especially when your reality may be like, if you're dealing with a long-term health condition or you're dealing with cancer, there's a lot that is going on for you, isn't there? You don't really kind of need these other negativities in your life. So having a space where you can I not pretend that everything's okay, because that's not what it's about, is it? But just feel looked after, supported.
Yeah, you can be normal and you don't have to worry about what you're saying. I'm going to say something, but it sounds stupid. Nothing is stupid. If you want to say it, then you just say it.
So do people come into you for services, or do you go to them? How does it work?
Normally we go to people, because a lot of people to travel here is too much like hard work, and it's like a real maneuver, for want of a better word. So we go to them. However, there are a few that we have coming into the office, because maybe they don't want husband, wife, children to find out what's going on. They're trying to protect a family member. So our office is a safe space as well.
Yeah, that's good. Do you have like open hours, or is it quite flexible? How does it work that way?
Yeah, we're always open.
Yeah, I mean, I pretty much knew the answer, but I thought it appears like you're always open. But I thought I'd ask the question just in case there was a look. So it very much seems that, you know, you try and be as accessible as possible, and you go to people as much as you can, but if they need to come to you, that they can come to you as well.
But Facebook seems to want you to have opening hours.
Yeah. I mean, it's all those things of being a business, isn't it? They want the structure and the never turn off. So I guess it probably is important to talk a little bit about your background, because I know it, but other people won't. So you touched on the fact that you did Reiki, but do you want to explain some of your other background that's relevant to what you do?
Yeah, I qualified as a nurse in Leicester in January 2000. I was the first Project 2000s. I worked at Leicester General in a GI and hepatobiliary ward for 6 months. Then I did 6 months medicine at Northampton, 6 months surgery, and then I went out to become a district nurse. I was a district nurse for 19 years, and then circumstances happened and I changed to be a practice nurse for 6 months. But then I actually managed to secure some funding to run a project through the charity, working for the charity with patients that have been affected by COVID, long-term condition and cancers, so we could provide our services to them. Basically, nothing changed for us in the pandemic, because we've already established we're a healthcare provider, so nothing changes, it's business as normal. But it did mean that we could offer those services to people that had treatment stopped, postponed, surgery postponed, cancelled, and that had nowhere else to turn to and nobody else to turn to, because they couldn't have visitors, but we could still go in and visit. They couldn't go anywhere, they couldn't see anybody, and you're already feeling alone at this time. So for us to be able to offer that arm of support actually made such a difference.
Yeah, I hear what you're saying. I mean, for many people, it's been really, really difficult time, and going through that experience and having all of your support taken away. I mean, I can't imagine how it must have been. So the fact that you could still continue to do stuff and go to people and still give that support, I'm sure made a massive difference. Yeah.
I mean, obviously because of the nature of what we do, we always have to be careful. So COVID made no difference. I started my training, I had a really old-fashioned system. We used to have to scrub the commodes till you could see your face in them.
Yeah.
Our beds had to be made in perfectly with matching sheets either side. I was washing my hands 40 to 50 times a day for the last 21 years, 24 years. So to me, when they're saying wash your hands, it made no difference.
Yeah. I mean, it's stuff you're already doing, and I guess with the clients that you're working with as well, you need to be mindful of all of these things all of the time.
Yeah, and it's like you wouldn't go into someone who's dying if you got a stinking cold, because that could potentially kill them, or someone who's bedfast or in a wheelchair. If you felt like really rough and really poorly, you wouldn't go into them with diarrhea and sickness or coughs, colds, etc. Because you could potentially take that in and they could potentially get it and it could potentially kill them. So
I guess like with the work that you do, there's a lot of risk assessment that goes on, a lot of making sure that the practitioners are the right practitioners for the people that they go to, that sort of thing. So what's the kind of criteria, I guess, for like matching people? Do you have how does it work?
Either myself or one of my other qualified nurses, we always go in, do a full detailed assessment, and then refer to the right person, because it's sometimes some people don't always match, like you say, don't marry. I mean, I will always take Tina in with me or whatever, so she's got to meet them. There's a couple of other girls who were volunteering who, through the pandemic, because of where they were working, did have a little break because of obviously with the risk of what was going to happen, and they didn't want to put our patients at any more risk. I mean, that sounds really sensible. I'm just trying to think if there's any more, because I feel like we've covered everything, but I also feel like there's loads more we could talk about, but without sort of going into like specifics of clients, which obviously we're not going to do. So is there anything else that you want people to know about the Lighthouse Centre that I haven't asked? There's not a lot. I mean, obviously they can check on the website, which you've put the details up. If there's anything else they want to know, if people want to ask anything, they can always message one of us, or if they want to know any more details, any more information. It's probably easier if they ask what they want to ask, because some people will be thinking, oh, I'd love to ask that, but I don't know if I can, or I don't know if I dare. But I think it's realising that ask anything. It's absolutely fine.
So no questions off limits. If you're not sure whether they're a suitable candidate for your service, to just get in touch anyway, because if they're not, then you can signpost them onto someone else, or like help them in some other way. And pretty much, like, from what I heard you say, is whatever way you want to get in touch, short of carrier pigeon, you can do.
I'm sure we could get a carrier pigeon in too.
Get a little pink branded pigeon in.
Pink pigeon, stop the pigeon.
Probably. So what have you got fundraising activities going on at the moment? Is there any way, if people are listening and think, actually this is great, it's not for me, but I want to support them, is there anything that's going on at the moment that they can get involved with?
Yeah, we've got our 100 club, which is basically you buy a number. Once we've filled the first 100 numbers, we'll start charging people. It's £1 a number per month, and then you've got the chance of winning. So once it's full, we'll start charging, and then every month you've got the chance of winning £25. Once we fill 200 numbers, there's the chance of winning £50, etc. And Steve's found a number generator for that. We've got Panto. I'm so excited. I'm going to be in a Panto.
That's
on
amazing.
the 19th of December, which is ages away, but it's getting everything planned, because it's not something you can just do overnight. No, that's going to be quite a big undertaking, I imagine. Where do you know where you're staging the Panto yet? Have you got a venue? Yeah, it's at Brackley Leisure Centre, and we're doing a matinee and an evening performance, so there'll be two for the kids and then for the grown-ups. But I'm just so excited. I might let me try a joint.
Cool. That'd be brilliant. And I guess through the website and Facebook to get tickets, things like that.
Yeah.
Perfect.
Yeah.
So is there other things that you wanted to say? Is there other things that are going on?
I don't think so. Obviously, if the people keep an eye, we've always got things that we can sell. We've got things that people have donated. We're often selling those on. Through the pandemic, we had people donating us jigsaws like they were going out of fashion, and they were fantastic, because if you can't go out, it's something to do, and you can still support at the same time.
And it kind of feels very much like you've got a big community around you. I know you recently did like a tabletop sale somewhere.
Yeah. Yeah.
And I saw the pictures, and it really feels like it is a community. So if somebody wants to get involved volunteering, what kind of opportunities are there?
It's for the volunteering side. If they're qualified, then they can help with the care delivery. We do, obviously we interview for that. It's not quite just I can come and be a volunteer.
I mean, I imagine there's quite an in-depth process, but reach out and get in touch.
Yeah, for that side. But for the other side, it's they can help with selling our products. I can soon WhatsApp a photo over, or one of us can do that. Helping with events, helping organise events, coffee mornings, cake sales, things like that. Anything that they think could help, would help. We've got a couple of people are doing the marathon next year. And they've said that they've put us forward, even though we didn't go into the ballot. They've already said that they want to do it for us.
That's amazing.
Which is, absolutely fab. And then obviously, you met Mark when Pete did us a bike ride and came down, and we stayed with you.
Yeah.
I don't know if anybody's brave enough to do Northampton to Cornwall again, but you know.
You never know. Somebody might be listening, and that's just their thing.
Yeah, in a pink t-shirt.
Yeah, perfect. Thank you so much for coming on and talking to me and sort of sharing a little bit about the Lighthouse Centre. I know like how important it is to you and how much hard work you do. And hopefully people listening, if they're in the Northamptonshire area, can get in touch with you, or if they're listening and just want to connect with the charity about some fundraising, that they will get in touch with you. It feels like this is a good place to stop. Is there anything that you want to leave people listening with before we go?
No, I think the main thing is just to get in touch if they want to, if they've got any concerns, any thoughts, any feelings, just get in touch. You know, nothing is like we said, nothing's a stupid question, nothing's out limits. It could be that someone's living in Outer Mongolia and is listening and thinks, I really need to ask this question, but I've got nowhere else to ask it. You can ask it, and if I can answer it, I will do.
Yeah, that's wonderful. Thank you, Gemma. Thank you so much for coming on and speaking with me.
Thank you.
Thank you. And to those that are listening, I hope you enjoyed today's episode. I'd love to hear your feedback. Find out more about me and my guests, visit srtt.co.uk or follow at SRTT Podcast on the social media platforms. I'll be back next Wednesday with a new guest. Until then, stay curious and be kind to yourself.